Hello everyone, this is Dr. Sandra Fryhofer, and here's what you need to know about the new shingles vaccine. Shingles usually starts in childhood with chickenpox. It's caused by the varicella zoster virus. That virus then hides in the body until it reactivates as shingles. The major risk factor for getting shingles is getting older. Both risk and disease severity increase with age, starting at 50. Shingles has two primary symptoms, rash and pain. Pain often precedes the rash, and it can be excruciating, as bad as passing a kidney stone or having a baby. For some patients, those with post-herpetic neuralgia, PHN, the pain can persist for months, even years. And there's more bad news. If you've had shingles once, you're not totally protected. You can get it again, but there are vaccines that can help. The older vaccine, the live attenuated zoster vaccine, brand name Zostavax, has been available since 2006. Only a single dose was recommended. Since it's a live virus vaccine, it can't be given to patients on high-dose immunosuppressants or those with immune system problems. And these are the very patients who might be at highest risk of zoster-related complications. The older vaccine cut risk of getting shingles in half and reduced risk of post-herpetic neuralgia, that severe and long-lasting pain, even more, by 66.5%. But the protection is not long-lasting and wanes after several years. By 6 years post-vaccination, vaccine effectiveness is less than 35%. By 10 years after vaccination, protection is pretty much gone. That's the older vaccine. There's now a new shingles vaccine, a recombinant zoster vaccine, brand name Shingrix. It's new, just FDA approved in October 2017. It's not live, but it does contain a brand new adjuvant to increase immune response. Since it's not a live virus vaccine, it may provide an option for immunocompromised patients at high risk for shingles, patients for whom the older live virus vaccine is contraindicated. But please understand, the adjuvant in it is new. It's only been studied in clinical trials, not out in the general population. 2 doses are recommended, at least 2 to 6 months apart. It's also very reactogenic, so you should expect to get a significant local reaction. The most common reactions were fatigue, muscle aches, and pain at the injection site, usually lasting for just a few days. But just because you react to the first dose, it does not necessarily mean you'll have a strong reaction to the second. It also seems to work better, much better. For those 50 and older, it cut risk of both shingles and post-herpetic neuralgia by over 90%. The vaccine also worked well in older patients, and protection seems long-lasting. On October 25, 2017, ACIP, the Advisory Committee on Immunization Practices, voted to preferentially recommend 2 doses of Shingrix to all immunocompetent adults 50 and older, including those who've already had the older shingles vaccine, Zostavax. 2 doses are still recommended regardless of whether or not you've ever had shingles, but don't get it while you have an acute shingles episode, because the vaccine's not a treatment for shingles or for PHN, post-herpetic neuralgia. So can this new vaccine be given to immunocompromised patients? FDA has licensed the recombinant vaccine for all adults 50 and older, but ACIP says not yet, wait, because of the new adjuvant. They want to make sure there are no unexpected surprises once it's out into the real world. But for patients with chronic medical conditions, diabetes, kidney disease, chronic heart and lung disease, it's fine to get it now. Bottom line, we have a new shingles vaccine. It's much more effective and protection seems to last, but when you get it, expect a local reaction. But that's better than getting shingles, and you need both doses. 2 doses, at least 2 months apart, for maximum protection. Now you know. I'm Dr. Sandra Fryhofer.